Types of facial aging. I distinguish three types of facial aging: volumetric, skeletal, and balanced, cheek dominant. Volumetric aging type. The face has a significant amount of fat in the mid-face and lower face, which increases with age. The face and neck become heavy and bulky. Deep nasolabial folds appear along their entire length, jowls develop. This type of aging is common in Eastern Europe and Asia. Skeletal aging type. The face loses fat in the mid-face and lower face. The face becomes skeletal and hollow. The cheeks thin, ligament and skin changes become visible, and the entire face descend: eyebrows, nasolabial folds, soft tissues. This type is more common among Northern European populations. Balanced or cheek dominant aging type. Volume is present mainly in the cheek area. Only the cheek fat descent. The lower face remains stable with the clear and beautiful jawline. This type is often seen in populations of Southwestern Europe. In countries like the US or Brazil, where there is a strong mix of nationalities, it is essential to understand the family lineage. Why this is important? People of different nationalities age differently, just like different breeds of dogs or cats. For each aging type, there are specific procedures, methods, limitations, and clear boundaries of what can and cannot be changed. I want to remind you something very important. Here, there is no SMAS. SMAS exists only here. That's why this part ages the least. SMAS means superficial musculo-aponeurotic system. Aponeurotic, a dense structure. This part of the face is what makes a person look older. Depending on how much fat is present, how soft this fat is, and how strong and weak the ligaments are. This combination mostly defines the aging type. A facelift cannot change who you are. A facelift repositions only volume in the middle and the posterior part of the face. Anterior facial fat will always remain unstable in volumetric and cheek-dominant aging types. We can influence the phenotype, but always within the limits of our genotype. Lifestyle, nutrition, and medical devices can improve how aging looks, but they cannot completely change it. If you have volumetric aging type, you won't achieve a sharply defined jawline, even with any facelift, compared of a skeletal and cheek-dominant aging type.